Hi, good morning. I'm Angela Shen. I'm presenting on behalf of Marcela, and if you're surprised I'm here, I'm just as surprised. Okay, so for most of you who may already be familiar with CAR T, it is a living drug. It's a genetically modified white blood cell. And as just now you could see in the lower left-hand corner, you can actually see this genetically modified cell attack and clear the targeted cells. In this case, it was a tumor cell. So we have several CAR Ts that are approved. In the upper right-hand corner, you can see one of the earliest experimental CAR T bags that were manufactured by UPenn for their early trials. Since 2017, several CAR Ts have been approved. We do believe that there should and will be newer, better CAR T technologies emerging to treat patients. The goal of the Maus Lab is to design and evaluate next-generation genetically modified CAR T cells as immunotherapies in patients with cancer and other life-threatening diseases. So I'll be taking you through select examples of novel technologies that have been developed, have been homegrown from MGH. Several of these, you'll note, are in clinic. So the inception occurred in the Maus Lab. They were taken through preclinical studies through IND and then into first-in-human phase 1 clinical trials. So some of the unmet needs include just the need to expand CAR Ts into newer or less common targets, and the need to be able to target multiple targets. So I think the field has really gotten CD19 and BCMA down well, so good job, field. But we do need to develop more CAR Ts, so there's a larger arsenal of options for patients and clinicians to use. At the top, you see the CD37-directed CAR T. This has been in clinic. A small handful of patients have been treated. And there have been some very interesting and promising early activity observed in this trial. Of interest, one of the hypotheses that's emerged from this trial is, can we use CAR T to specifically deeply clear tumor from, for example, relapsed refractory AML patients to enable transplant, bone marrow transplant for these patients. There are several of these patients who cannot go to transplant with a good outcome because they can't clear enough of their acute leukemia to do so. So can CAR T be used to enable better transplant outcomes, to bridge to transplant and enable better outcomes? Next on the list, you see what we call TriProl, which is the triple concatenated APRIL ligand CAR used for targeting multiple myeloma. In this, the ligand binds both TACI and BCMA. It's an all-human sequence. Next on the list is the CD79B, CD19. Sometimes I call this CAR 1979B. And this is, again, it's important because this CAR T is multi-targeted, so it can address antigen escape or just tumor heterogeneity. And in general, we do need more options that are multi-targeted in this modality. The IND has been submitted, and we look forward to seeing the clinical results that come out of that. For the fourth row, you'll see CAR Team, and this is a fascinating platform where the CAR Ts have been engineered to secrete something we call a team molecule, and I'll get into that in a minute with some more details in the following slide. But this platform where you can mix and match the type of CAR T you want and the type of team that it can secrete allows for multi-targeting and also allows for a method to redirect Tregs that are usually immunosuppressive in the tumor microenvironment, redirect those to become cytotoxic, thereby addressing one of the challenges we have in solid tumors, which is an immunosuppressive tumor microenvironment. So I'll be showing a couple slides on that. For the CD70-directed CAR, this was an interesting problem. The native CD70 CARs that are out there right now have a problem with shedding of the ligand, of CD27 ligand. So the Maus Lab was able to modify the hinge to reduce or prevent shedding of the ligand and therefore make a CD70-directed CAR that theoretically works better. The second to last on the slide, enhanced potency via CRISPR. So a novel way of developing higher potency CAR Ts to direct not just solid tumors, but other types of cancers as well. There are multiple constructs under development. This one is still early and still in sort of stealth mode. And then last, you see on the, just as an example of these select examples, you see stealth technology, where the CAR Ts are engineered to express a certain protein that will protect the CAR T cell from being seen by the immune system, thereby mitigating rejection of both allogeneic or autologous CAR T. There's value in both. So these are just some examples of technologies emerging from the Maus lab. I'm going to just, of these, show you a few examples and some data, and then we can move on. All right, so regarding the CD70 as a target, it's a promising target in AML, but also in some solid tumor indications. As I mentioned before, shedding of the ligand limits activity of native CD70 CARs. The Maus lab has managed to modify the hinge and has shown that it resists cleavage and also eradicates AML in the PDX model. Avidity enhanced the modified hinge, which is the CD8 hinge and transmembrane CAR, was shown in the lab to outperform native CD70 CAR and eradicate tumor when combined with AZA. For CAR team, and I'm going to describe a little bit more what the team was that I mentioned before, but team stands for T-cell engaging antibody molecule. Teams are a form of dual-specific T-cell engagers, conceptually similar to BiTEs. And if anybody here's from Amgen, I'm making the note that BiTE is a registered trademark of Amgen, so we're not allowed to use that term, but team is what's secreted by these engineered CAR Ts. And what's interesting is because CAR Ts can traffic to the site of the tumor or the site of the target, the team that's secreted tends to be concentrated locally at the site of the tumor or the target cells. Systemically, the teams can be cleared rapidly, which has potentially favorable toxicity implications. We know that the team in the lab appears to bind to both CAR-positive and bystander T cells, so can basically make bystander T cells also more effective. And as I mentioned before, redirect Tregs to become cytotoxic. So that does have the potential for mitigating some of the immunosuppression that Tregs usually cause in the tumor microenvironment. So the CAR itself on the T cell can bind one antigen of choice, and the secreted team can bind a second antigen of choice. So you have the ability for multi-targeting here. The three constructs currently in development, but in theory there could be more because you can mix and match, but the three constructs currently in development are EGFR v3 CAR that secretes wild-type EGFR, mesothelin CAR that secretes FAP team, and CD70 CAR that secretes a CD33 team. So just quickly, this first one targeted for GBM, EGFR v3 CAR that secretes wild-type EGFR team. Some compelling in vivo data have been noted in this trial. This construct is actually in first-in-human phase 1 trial. It's been initiated. For the second team construct, this was the mesothelin CAR that secretes the FAP team. FAP is interesting. It's a fibroblast activation protein. By secreting the team, the thinking is that you'd be targeting some of the tissue stroma, breaking that down to allow for CAR T and more immune cells to infiltrate and work more effectively. Still early, but some very interesting data emerging from this construct. And the third construct targeting AML would be the CD70 CAR secreting the CD33 team. So CD33 is a great target for AML, but systemically tends to be quite toxic. But in this case, if the CD70 CAR is secreting the CD33 team locally near the tumor cells, that might affect efficacy as well as reduce some of the safety issues that tend to go along with CD33 treatment. In this case, the Maus lab has demonstrated elimination of CD33 or CD70 negative antigen tumors in vitro and in vivo in mixed tumor and PDX models. So summary next steps. We all know that CAR T therapies have a critical role in treating patients with life-threatening diseases. We know that we need to tackle a number of challenges to bring CAR T technologies to the next level, and this includes being able to expand into new targets, being able to go after multiple targets, being able to mitigate some of the suppressive tumor microenvironment issues, increasing potency in a select way, and being able to mitigate rejection of both allogeneic and autologous CAR Ts. MGH is a globally recognized CAR T center of innovation. The Cellular Immunotherapy program at MGH enables accelerated bench-to-bedside proof of concept, as you've seen from several of these programs progressing into clinic. There are several novel CAR T programs in clinical trials. Others are earlier in development, IP filing supporting each new construct, and we are actively seeking partners and collaborators to bring these novel CAR T technologies to the market. Thank you very much.